So imagine your cardiovascular system as a complex network of pipes with your heart as the central pump. When the heart contracts, it generates pressure, pushing blood through these pipes, which we call arteries and veins. Now, the force of this blood against the walls of the arteries is what we measure as blood pressure. Now, imagine if the walls of these pipes become stiff and less flexible. This makes it harder for the blood to flow through, causing the pressure to rise. That's essentially what happens in high blood pressure or hypertension. And the thing is, you won't feel this pressure build up inside your arteries. There are no obvious symptoms, which is why high blood pressure is often referred to as a silent killer. Over time, this elevated pressure can lead to serious health problems like heart disease, stroke, and possible kidney damage. So when you're diagnosed with high blood pressure, lifestyle changes like eating a balanced diet and maintaining a healthy weight are often the first lines of defense. But these changes can help, but they're not always enough to bring your blood pressure back into a healthy range. And that's where medications like diuretics or water pills come in. These drugs work by reducing the amount of fluid in your bloodstream, which helps you to lower blood pressure. But they do this by increasing the amount of water and salt that your kidneys remove from your body through urine. However, these medications often cause unwanted side effects and other health concerns. But that's where magnesium comes into play. See, magnesium is an essential mineral that plays a crucial role in regulating blood pressure. It actually helps to relax the smooth muscles in your blood vessels, allowing them to dilate and reduce resistance to blood flow. And this can help to lower blood pressure. In fact, studies have shown that people with high blood pressure often have lower levels of magnesium compared to those with normal blood pressure. And one study found that taking magnesium supplements for 3 months significantly reduced systolic and diastolic blood pressure in people with hypertension. The question is, do you really want to wait 3 months, or we can actually possibly speed up the process? And here's where a specific form of magnesium called magnesium ionic chloride can be particularly helpful. See, taking 200 milligrams of magnesium ionic chloride every 3 hours can help to maintain a steady level of magnesium in your body, promoting healthy blood pressure throughout the day. But keep in mind, magnesium isn't the only supplement that can help. L-taurine is an amino acid that has also been shown to have blood pressure lowering effects. When taken at a dose of 3,000 milligrams every 3 hours along with magnesium, L-taurine can actually work synergistically to support healthy blood pressure levels. But there's one more piece to this puzzle: bicarbonate. See, bicarbonate is a compound that can actually help to increase the pH in your small intestine. This is very important because a more alkaline environment in the small intestine can actually enhance the absorption of magnesium and other nutrients. So by taking bicarbonate alongside magnesium and L-taurine, you can optimize their effectiveness in regulating your blood pressure. But remember, magnesium isn't just important for blood pressure regulation. It's involved in over 300 enzymatic reactions in the body and is crucial for energy production, muscle and nerve function, and bone health. Symptoms of magnesium deficiencies can include muscle cramps, headaches, eye twitches, fatigue, anxiety, insomnia, irregular heartbeat, and even high cholesterol. Potassium is another mineral that works hand in hand with actually magnesium to regulate blood pressure, and potassium does help to balance out the effects of sodium, which can contribute to high blood pressure when consumed as white table salt and in excess. So before starting any blood pressure medication, it's a good idea to have your doctor check your magnesium and potassium levels. This can be done through a simple blood test called an RBC magnesium test, which measures the amount of magnesium inside your red blood cells and make sure it's not serum testing. It's also worth noting that certain blood pressure medications, particularly diuretics, can increase levels of homocysteine in the blood by up to 16%. And homocysteine is an amino acid that, when elevated, can actually damage the lining of your arteries and increase the risk of heart disease and stroke. This might explain why some people's blood pressure remains very high even while taking medication. So managing high blood pressure involves a multifaceted approach that includes lifestyle changes and appropriate nutritional support by incorporating magnesium ionic chloride, L-taurine, and bicarbonate into your regimen alongside a balanced diet and regular check-ins with your healthcare provider. You can take a proactive step towards maintaining a healthy blood pressure and protecting your cardiovascular health for the long term.